Albini, and this is my Implications of Disability research presentation. This project examines the implications of disability on access to reproductive health care. People with disabilities often face social, cultural, and environmental barriers that limit their access to reproductive services. These challenges contribute to disparities in contraception access and use, prenatal care, pregnancy, and informed decision-making. Analyzing and addressing these issues is essential for advancing disability-inclusive policies and healthcare practices. The social model of disability asserts that disability is created by societal barriers and not by individual impairment. This model applies to reproductive health care as societal barriers such as inaccessible clinics, provider biases, and lack of disability-inclusive education limit healthcare access for people with disabilities. These barriers, rather than disabilities themselves, create reproductive healthcare disparities. Cultural perspectives on disability play a significant role in shaping both stigma and access to reproductive healthcare worldwide. One common assumption is that people with disabilities are asexual, which not only affects how they see themselves but also reinforces bias. Additionally, historical contexts such as the legacy of eugenics and supernatural beliefs further influence societal attitudes and healthcare practices. Societal perspectives on disability shape how reproductive healthcare systems and providers accommodate or fail to accommodate people with disabilities. One key issue is the perception that people with disabilities are incapable of making informed reproductive choices, leading to medical paternalism, where providers make decisions on their behalf, disregarding their autonomy. This can result in coerced contraception, sterilization, or lack of access to fertility treatments. Additionally, societal emphasis on normalcy often excludes disabled individuals from conversations about sexuality, family planning, and parenting. Many healthcare facilities are not designed with people with disabilities in mind. Examples of this are inaccessible exam tables, inadequate transportation options, and a lack of assistive communication tools. These physical barriers can prevent or discourage individuals from seeking reproductive services. Beyond physical accessibility, systemic factors such as long wait times, limited provider training on disability-inclusive care, and financial constraints further restrict access. Overall, cultural, social, and environmental perspectives on disability influence their ability to access equitable reproductive healthcare services. These perspectives create barriers such as stigma, lack of accessibility, and insufficient provider education, which compound in limiting people with disabilities access to reproductive health care. Addressing these disparities will require an approach that includes policy reforms, cultural shifts, and improved training for healthcare providers to ensure that disabled individuals can make autonomous and well-informed reproductive health choices. This concludes my presentation. Thank you.